Now, in the case of late onset neonatal sepsis, basically, when you have late onset neonatal sepsis, you should think of the sepsis. So you are going to have in sepsis, I forgot to also tell you that you are going to have systemic inflammatory response syndrome, meaning that what the temperature is going to be elevated. You are going to have a temperature elevated at 38.5 degrees Celsius. You are going to have also tachycardia. In neonates, the tachycardia is going to be greater than 160 beats per minute, and you have also a tachypnea. Tachypnea is when you have a respiratory rate of more than 60 cycles per minute in unit, because normal is supposed to be 40 to 60 cycles per minute, while tachycardia is normally supposed to be 120 to 160. If it's more than 160, it's going to be fetal tachycardia. And so now the next, so after having the systemic inflammatory response syndrome plus a leukocytosis that is visualized on the full blood count, you have now also a point of focus generally in late onset neonatal sepsis. Particularly if you have upper respiratory tract infection, you must evaluate for the nasal mucosa to find if there is any nasal discharge or there is any inflammatory signs of the nasal mucosa, like redness, like tenderness, like swelling and all that. The next element you have to evaluate also at the level of the oral mucosa. In the oral mucosa, you evaluate the tongue to visualize if there is any redness that is going to be glossitis or signs of inflammation of the tongue. You visualize the tonsils to visualize if there is any signs of inflammation of the tonsils. You will call tonsillitis. And you visualize also the pharynx to visualize if there is any signs of inflammation of the pharynx, called pharyngitis. Also, you have to visualize at the level of the ear. You visualize the external ear to find if there is any signs of inflammation. You visualize the internal ear by doing otoscopy. That's why every time you have a patient that you think of upper respiratory tract infection, you must always do an otoscopy. So you must evaluate for the ear with the otoscope. So after evaluating inside the ear, the next thing that you have to evaluate also after the ear, now you have also with the otoscope, you have to evaluate also at the level, you have already said at the level of the eye to find if there is redness of the eye, find if there is redness of the eye, find if there is tearing of the eye, to know if there is conjunctivitis or tenderness at the level of the eye. So those are the different elements that you need to know, evaluate when you have an upper respiratory tract infection. Now, after having upper respiratory infection, you now want to characterize for a lower respiratory tract infection. Generally, in lower respiratory tract infection, the major elements, those the bronchial breakdown beats reduced, or all those signs of consolidation are very difficult to visualize in a child because the child is not compliant and is not going to tell you 99 and all that. So the major element that you have to do is audition by auscultation. When you auscultate the chest and then you have crackles which is located on one lung field, it is going to be much more towards a case of a consolidation syndrome. You can have other element of consolidation syndrome like increased tactile firmity. So on inspection you can have a trachea deviation which is less likely. On inspection also you can have a chest expansion reduced on the affected side. You have the next one you can have on palpation, you can have tactile firmity increase on the affected side. You have also percussion, you have dullness, and you have crackles and bronchial breath sounds. All that are signs of consolidation. When you visualize signs of consolidation, you are going to much more think of a pneumonia. But now when you are going to have instead wheezes, if you have wheezes and then you have fever, you must instead think of respiratory bronchiolitis as being the lower respiratory tract infection. Is it clear? So, and wheezes are much more expiratory musical sounds. Like you are going to hear it like so as such. You're going to hear it. That's how you're going to hear inside the chest. Is it clear? You can have audible wheezes that you can hear when the patient is directly expiring, and you have also auscultatory wheezes, which are expiratory wheezes, usually associated with expiration. You will hear sounds like the inspiration is normal, but on expiration you're going to hear sounds like So those are musical high-pitched sounds. Is it clear? Now, after lower respiratory tract infection, you want now to evaluate for the other elements, which is the omphalitis, is equal to umbilical cord. So if you want to evaluate for omphalitis, what you just assess is on physical examination, you assess the umbilical cord to find if there is any signs of inflammation like redness, tenderness, swelling and all that. or even if there is purulent discharge from it. Now, after the omphalitis, you also assess the skin to find if there is any rashes, maculopapular rash, a boil, or any pustule that can tell you that there is an inflammation of the skin which can result to the fever. The next thing you have to evaluate also, for the urinary tract. You palpate at the level of the suprapubic region to find if there is any inflammation of the bladder with the cystitis, or you palpate at the level of the costal-renal angle to visualize if there is any acute pyelonephritis. So those are the elements that you visualize for urinary tract to know if there's a urinary tract infection. Now, if the point of focus now is the GIT, you now palpate at the level of the epigastric region to find if there's tenderness, the periumbilical region to find if there's tenderness, and the hypogastric region to find if there is tenderness. Is it clear? And then you're going to have also signs of all those signs that I've already mentioned. Is it clear? So those are the different elements, all those signs like diarrhea, vomiting, and all that. So diarrhea, vomiting, and all that. Now the next element, so after visualizing now for late onset, so those are the elements that you must visualize in cases of late onset neonatal sepsis when you are doing the physical examination. Now the next point now you're going to move on to is how to make your diagnosis of, or what are the complications of neonatal sepsis.